Hi, I'm Dr. Supriya Sriganesh, Consultant Cataract and Refractive Surgeon at Nethradhama Super Speciality Eye Hospital, and today we'll be talking about red eyes. So, redness in the eyes is something very common that almost every one of us face in our lifetimes. So, when is it serious? When is it non-serious? When should you come to the hospital to get it treated? Let's talk about all of this. Now, there are multiple causes for red eyes. One may be an infection, the other one may be inflammatory causes, another one may be trauma if you've hurt your eyes, and another one may be other underlying conditions such as glaucoma, etc. So, let's talk about each one of these things. Now, first coming to infections, infections are one of the most common causes for red eyes. Now, if your eyes are red and apart from the redness you are experiencing some discomfort such as itchiness, watering, discharge, pain, it could indicate that you have an infection, especially if your eyes are swollen and if there is some discharge, especially yellowish discharge that is coming out of the eye, then it indicates an infection. Now, an infection is something that must be treated with eye drops, eye ointments and certain adjuvant treatments. So, this is one of the causes for which you must definitely visit the hospital and take treatment. So, the second type of redness is caused by inflammation. So, what does inflammation really mean? It means that there is some kind of reaction in the eye. The eye or the body is reacting to some external stimulus and causing some kind of reaction or inflammation. Now, if it is because of just some dryness, dry eye, allergy or reduced sleep, things like this, then it can be self-limiting, which takes care of itself in a few hours or a day's time. But if this kind of redness is associated with some pain, discomfort, and if it does not resolve itself in a few days, or if it's recurrent, meaning it keeps happening again and again, then you must definitely visit the hospital because it could be associated with something deeper in the tissues of the eye or somewhere else in the body, which could indicate some inflammation in the body, which is a response to that inflammation. The third type of redness is because of trauma. If the eye is injured, if the eye has got any kind of injury, it could be as small as a fingernail injury which has caused a small scratch on the cornea, or it could be a deeper penetrating injury with a stone, dust, an insect, anything which is stuck in the eye, or an even more grievous injury where there is a penetrating injury into the eye. Now, of course, the latter definitely requires treatment and in most cases a surgical intervention. But what about the smaller things where, when something has fallen into the eye, where there is a small scratch in the eye? The first thing we need to do is just wash the eye and make sure that that foreign body is removed. Please wash your eye with clean water and do not rub the eye. Make sure that you visit the ophthalmologist or the eye specialist if you have pain, increased watering or a pricking or burning sensation. These kind of things take about 48 hours to heal with treatment. So, do consult your ophthalmologist. The other type of redness can be caused due to other ocular problems, eye problems such as glaucoma. Now, there is a type of glaucoma called acute angle closure glaucoma, where the pressure in the eye increases to the point where there is no place for the fluid in the eye to drain out. So, this causes a blockage and a sudden increase in the eye pressure. It causes pain, redness and a drop in vision. So, if redness is ever associated with pain or a sudden drop in vision, please do visit the hospital on an emergency basis and get treated for this. And the treatment may be simple, but it does need to be treated on an emergency basis if it is associated with vision loss.